Je voulais juste donner des félicitations à tous mes collègues, les médecins hygiénistes en chef de tous les territoires et provinces aujourd'hui. Et aussi, je voulais donner un petit commentaire, une mise à jour sur le vol hier de WestJet, que j'avais dit qu'il y avait un cas qui avait été sur le vol le 27 avril. Mes staffs ont fait des recherches et travaillé avec l'Agence de santé publique du Canada et aussi avec nos partenaires de santé publique en Alberta. On a découvert que le cas était diagnostiqué en Alberta, mais durant le temps qu'il avait pris le vol, la personne a pris le vol, il n'était pas contagieux. Alors, c'était une petite erreur en processus pour annoncer le vol à ce niveau-là. Alors, on fait plus de discussions et plus de réunions pour identifier des choses dans le processus qu'on peut améliorer pour la communication, etc. Alors, pour éviter que ça arrive de nouveau. Mais je voulais aussi féliciter mes staffs pour tous les appels, tous les courriels qui vont falloir faire pour trouver toute cette information-là. So before I start, I just wanted to say thank you to all my colleagues across the country, to congratulate them on all of their hard work. All the chief medical officers of health across the country in every province and every jurisdiction in this country, every territory, is battling this pandemic in their own way, in their own challenges. And so each and every province is dealing with different challenges at different times, and I know that they are expending a lot of time and energy, just as we all are. And I just wanted to give a shout out to them because I know how hard they are working. And again, we're all going through this pandemic in different stages and phases and with different challenges, and each and every one of us needs the support of the public at this time as we go through this. So again, I just wanted to give that support to my colleagues across the country. And I also wanted to give an update on the WestJet flight that we announced yesterday with respect to the case. I had my staff track down a bit more information working with Public Health Agency of Canada as well as our public health partners in Alberta. And what we found out was that the person who traveled on that WestJet flight had been a positive case tested in Alberta, but they had finished their self-isolation period after their diagnosis, and so at the time that they flew, they actually weren't contagious. And so there was a little mix-up in terms of the process of putting that flight on the public website. And so what we're doing as an after action is to just go through the processes and communication issues around that, just to make sure that we're all clear and that doesn't happen again. But I just wanted to reassure the public that that was an error and the person who traveled on that particular flight was not infectious at that time. So here we are. Today, we are in the midst of a global pandemic. And virtually every nation, every province and state in the world has felt its impact. And we are part of this world. We have fared far better than most jurisdictions, but we cannot completely shut ourselves off from the effects of COVID-19. We will see more cases, and what matters is how we respond to the new cases when they arise. And today there is a new case to report in New Brunswick, and so this brings our total to 120 since our first confirmed case on March the 11th. And this new case is an individual aged 20 to 29 in Zone 2 in the St. John region. And this confirmed case is a travel-related case, and they were a close contact of a person who was diagnosed with COVID-19 in Ontario. And the good news about this case is that this person obviously was contacted by Public Health in Ontario, identified as a close contact, this person was not aware, when they traveled here that the person in Ontario had tested positive. But when they were here, they were by themselves, they were self-isolating, and they developed symptoms, and they immediately called 811 and got tested. So they actually did not come into contact with any other person during the time that they were contagious. So that is very good news about that case. And so again, the one that I'm announcing today is travel-related. The other one that I announced previously, they are still gathering information on that particular one in terms of trying to determine whether it's community transmission or travel-related. So as soon as I get that information, I will fill you in on those details. So, j'annonce aujourd'hui qu'il y a un nouveau cas à signaler au Nouveau-Brunswick, soit le 120e cas depuis le premier cas confirmé le 11 mars. Il s'agit d'une personne âgée entre 20 et 29 ans dans la zone 2, soit la région de Saint John. La personne affectée a effectué un voyage à l'extérieur du Nouveau-Brunswick. Et comme pour le nouveau cas confirmé que nous avons annoncé hier, nous nous y attendions. Personne ne doit s'attendre à n'avoir aucun cas à signaler chaque jour. Jusqu'à qu'un vaccin ou un autre traitement devienne largement accessible, d'autres cas de COVID-19 seront confirmés au Nouveau-Brunswick. Ça, on ne peut pas éviter. Until a vaccine or other treatment becomes widely available, we will see further cases of COVID-19 in New Brunswick. And when that happens, our public health teams will work tirelessly to track down the contacts and make sure they're isolating and if they have symptoms, and that way we can slow the spread of the disease. We will continue to have movement in and out of our province, even with the current restrictions on non-essential travel, and that carries the risk of new cases as we are seeing today. So I do want to remind everyone, anyone that comes into the province from outside of New Brunswick has to remain in self-isolation for 14 days. And again, that is to protect the population, including the most vulnerable people in our population, and I will speak a little bit about that later. There are, of course, some exemptions to that, and specifically under the order of the Chief Medical Officer of Health in Section 17 of the mandatory order. And I'm still having discussions. We have meetings around that. So when those meetings are finished and we've made our final decisions about what we are going to be allowing around the border issue, then I will fill you in on that as well. So given our geography, there will be travelers who want to pass through New Brunswick on their way to another province. And all of these travelers will be screened when they enter the province and at our land borders and our airports. And speaking of airports, with the case from WestJet yesterday, I do want to thank public safety. They had their employees had collected information at the airport that they were able to help in our tracking down of all the details of that particular situation. So I just want to thank them as they have been there at the airport since April 27th doing the screening. So at the borders, they tell the people traveling in about the public health directives. Et aussi, en compte tenu de notre emplacement géographique, des voyageurs voudront traverser le Nouveau-Brunswick en route vers une autre province. Ces voyageurs feront l'objet d'un contrôle à leur entrée dans la province à nos frontières terrestres et nos aéroports et seront mis au courant de nos directives en matière de santé publique. Et comme je viens juste de dire en anglais, je voulais remercier les employés du département de sécurité parce que les personnels à l'aéroport nous avons aidés avec les détails qu'on cherchait pour trouver toutes les informations qu'on voulait pour les situations hier de WestJet. Les personnes qui répondent aux critères de contrôle pourront se rendre directement à leur destination finale. Those who pass screening will be told to proceed directly to their final destination, and peace officers at our ports of entry are authorized to deny entry to any person who does not provide a valid reason for travel. So I am aware of cases where people are being turned away. So we are taking these actions in order to protect everyone's health. In particular, we need to protect the most vulnerable members of our society who are at greatest risk from the disease. And when people talk about releasing measures or relaxing the measures that we have in place right now, there are many, many factors involved in those decisions, including the number of cases, the type of transmission that we're seeing, but also what things we have in place structurally and from a public health perspective. And what we really do need to make sure and that we can ensure is that we have the proper amount of testing available, that we have the ability to do good contact tracing, that we are protecting our vulnerable populations. And so that's why this piece is so information as we start to release measures. Those who have immune deficiency diseases, disabilities, or other chronic health conditions face particular risks. We know that they do have a higher risk of having complications from COVID-19. And so we also want to protect those New Brunswickers who are facing mental health and addiction issues. So anybody who is struggling before COVID-19, obviously we need to take extra care of those people at this point in time. Those in poverty and those living in crowded conditions are at greater risk. But as we have seen elsewhere, the gravest danger is to those living in our long-term care institutions. And so we've been doing an awful lot of work around all of these populations to make sure that we have things in place to protect them. New Brunswick has 549 long-term care facilities, including nursing homes, special care homes, and other adult residential facilities. And we have had working groups specifically working on all the details around vulnerable populations, again, to ensure that we are doing all of the things that we absolutely can to protect these populations. And the long-term care facilities are home for 12,000 New Brunswickers. And every one of these residents is at great risk from COVID-19, as are the staff, so we want to protect them as well. So we have seen the devastation that COVID-19 has caused among the elderly in Canada, particularly those in nursing homes. In Quebec, Ontario, Nova Scotia, nursing homes have been challenged and decimated by multiple deaths from this disease, and no one wants that to happen here. So we have taken decisive actions early on in the pandemic to protect nursing home residents, but we still are doing more work, again, to make sure that we're doing everything that we can to protect them. So at this point in time, visitors are not permitted, and staff are using personal protective equipment and are regularly screened and tested when symptoms arise. There are strict cleaning and hygiene protocols that are in place. And should an outbreak occur in a New Brunswick nursing home, plans are in place to address it quickly and effectively. The inability to visit and touch an elderly relative is very hard for residents and their families. So we are looking at some of the palliative care policies right now, and I'll have more information on changes to palliative care visitations in the days to come. But these measures are vital to protect those who are in the gravest danger from COVID-19. We must make sure that our long-term care residents, as well as those who work in these facilities, stay healthy and safe. And I can tell you that we will be testing our plans to ensure resiliency. So sometimes we do tabletop exercises, sometimes we do mock exercises to screen to make sure that we have everything in place that we need to have in place. And so we want to make sure that we do our part and everyone does their part to protect those in the greatest need of protection. So what can you do? Well, I was interviewed yesterday on a couple of radio stations, and Ms. Crash Barton, on his show, he said, "Are you proud of New Brunswickers?" I said, "Yes, I am very proud of New Brunswickers." So keep doing what you're doing. You need to stay at home as much as possible, and if you are outside, it's for exercise and fresh air. You need to stay in your two-household bubble as much as possible. As we see, if a travel-related case does occur, then we know that the close contacts would be limited to those spaces. And if you are coming from another province and you are self-isolating for 14 days, you need to hopefully be able to not share a room with somebody and hopefully not share a bathroom with somebody and stay 2 meters away from people. When you do go out, again, maintain that 2 meters of physical distance between yourself and others. And when that's not possible, I strongly recommend that you wear a community face mask that covers your mouth and nose, again, to protect those vulnerable people, so people who are elderly, people who have comorbid conditions, heart disease, lung disease, cancer, immune problems. So wash your hands regularly. There was a post on the Public Health Agency of Canada Twitter feed around really effective hand washing and how this is one of the really crucial things to keep doing as we move through the different phases of this pandemic. And again, that's how we're going to protect each other. The same is true when you cough into your sleeve. Remember to not touch your face. Everything that you can do to lessen the chances of further spread of COVID-19 is vital and it's life-saving. So you can continue to do all of these things, closely monitor yourself and other people, family and friends. If you have symptoms, please call 811 and get tested. And they can be very mild and get tested anyway. I think we've done 490 tests since yesterday. That's a great number. I would love to continue to see numbers like that. So I encourage everyone who can get tested to get tested. Have a very low threshold for calling 811. Les 2 derniers jours ont prouvé que le virus responsable de la COVID-19 est toujours présent parmi nous et il demeurera parmi nous pendant un certain temps encore. Nous devons apprendre à vivre avec ce virus et j'ai confiance que nous pouvons y arriver. Et comme j'ai dit en anglais, j'avais fait une entrevue avec sur le radio hier, puis celui qui était là m'avait demandé Dr. Russell, est-ce que vous êtes fier de les Néo-Brunswickois puis les Néo-Brunswickois? J'ai dit oui, je suis très, très fière à tous les citoyens du Nouveau-Brunswick. Alors oui, continuez avec ce que vous faisiez. Et nous pouvons faire la transition vers la nouvelle normalité tout en continuant à protéger notre santé et celle de nos proches et en veillant du même coup à ce que les personnes les plus vulnérables de notre société demeurent également en sécurité. Et comme c'est la semaine pour la santé mentale ici au Canada, je encourage tous les gens de faire les choses pour protéger votre santé mentale et chercher les ressources pour vous aider. Et ça, c'est tout ce que je voulais dire aujourd'hui et je vous remercie beaucoup. Thank you very much.
Good afternoon. Bonjour. As we heard from Dr. Russell, we have had 2 active cases of COVID-19 in New Brunswick. This is not a surprising development. In fact, it is something we have been speaking of and preparing for in our fight against this pandemic. Our public health officials are tracking the cases now. They will work to keep the cases contained and avoid a larger outbreak of the virus. Ces nouveaux cas démontrent clairement que cette pandémie n'est pas finie. La situation est grand, même très bonne ici, au Nouveau-Brunswick. Mais nous devrons continuer à collaborer pour traverser cette crise. This is a reminder that we will need to continue to follow the directions of public health and obey the emergency order. We are continuing to succeed by keeping the situation contained and not overwhelming our healthcare system. That was always the goal, and it remains our goal today and in the coming days. While we must all continue to take measures to keep ourselves and everyone around us safe, we can also be thankful for the progress we've made as a province. Ces nouveaux cas ne nous empêcheront pas d'aller de l'avant avec notre plan de rétablissement. Bientôt, un plus grand nombre d'entreprises pourront reprendre leur opération et il y aura plus d'activités qui seront permises. I've been encouraging businesses for weeks to prepare for the new normal and reopening. We are just days away from announcing that. In fact, it will be this week. I'm asking you again to plan and prepare. Determine how you can operate within the public health guidelines of physical distancing, cleanliness, and hand washing. As part of this, more people will be returning to work. If you are one of the New Brunswickers that currently does not have a job to return to, I encourage you to visit the Working NB website and apply for available jobs. Nous comprenons le besoin urgent de trouver des personnes pour occuper des emplois de divers secteurs, comme les pêches et l'agriculture. Les personnes de bureaux régionaux de travail NB collaborent avec les employeurs et secteurs pour évaluer leurs besoins. Job opportunities we uploaded to Job Match NB over the next few days. Employers are encouraged to participate in the free virtual career fair, May 12th to 13th, at www.workingnb.ca. We are also looking at other interventions that may be required to support employers' needs. This is not the first challenge we have faced since the pandemic began, nor will it be the last. Nous savons que chaque mesure que nous prenons pour rouvrir notre province comporte des risques. C'est pourquoi nous faisons tout ce que nous pouvons pour minimiser ces risques pour le bien de tous les gens de Nouveau-Brunswick. I know people are concerned about borders too, as am I. As we relax restrictions on movement within our province, we need to take care to control the flow of people into New Brunswick if we are going to keep our curve flat and contain the spread of the virus. Border controls were put in place on March 25th and will continue for the foreseeable future. What this means is that we only allow essential travel into New Brunswick. To the extent of our ability, we keep non-essential travelers out. 5 personnes différentes qui sont arrivées par avion au Nouveau-Brunswick ont réalisé que nous sommes sérieux concernant les déplacements. non essentiels de notre province. Les gens qui arrivent par avion sont contrôlés à leur arrivée par des gens du ministère de la Santé publique. On leur demande la raison de leur voyage ainsi que leurs coordonnées. 5 people have been turned away and put back on airplanes. We also turn people away at our 7 provincial entry points. Over the last 10 days, an average of 38 vehicles have been turned away daily. It is important to acknowledge that we do allow people to enter. We have groceries and medications, fuel, and hardware to buy when we need them because commercial drivers bring them to our stores and gas stations. Commercial drivers are essential to our supply chain. Drivers have to follow guidelines from the Chief Medical Officer of Health to reduce risk. We also allow people to cross our borders to work. If they're coming to work for a few weeks or months, they have to self-isolate 14 days on arrival. Certaines personnes habitent dans une province ou travaillent dans une autre province. Ces personnes sont autorisées à entrer dans la province pour venir travailler. Après un séjour dans une autre province, les gens de Brunswick sont autorisés à revenir à la maison, et ils le seront toujours. Cependant, ils doivent s'y auto-isoler pendant 14 jours. I've asked my team to review the effectiveness of our border controls. We are vulnerable to the virus no matter what steps we take, but we must do everything we can to minimize the risk. I am discussing our border controls with the all-party committee, and if we find room to improve, I assure you that we will make the necessary changes. I know the Brunswickers will keep doing their part to stop the virus from spreading. We expect that there will be more new cases of COVID-19 in the future, and we will respond quickly to keep these cases contained. To date, we've seen many people step up to help pull our province through this pandemic. I am confident our success will continue as our people continue to step up for our province. Thank you. Merci.
Merci, Monsieur le Premier Ministre et Dr. Russell. Thank you, Dr. Russell and Premier Higgs. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Silas Brown, Global TV.
Hi, Dr. Russell. I'm just looking to clarify how this case that you announced today was identified. I'm just a little confused. So you said that they were identified by contact tracing from a case connected in Ontario, and then were they tested here, or had they been tested in Ontario, and then they were in their, I assume, their mandatory 14-day isolation period after arrival, but how were they identified?
So I think I corrected myself when I first, because I originally thought, again, I'm trying to keep all the details in my head, they're not written in front of me. So my understanding is that person was a close contact of somebody in Ontario who was tested positive. And my understanding is, again, I would have to check on the details of when the identification of them as a close contact came to light. All I can tell you, again, what I remember from the details are that they had no contacts with anybody here in New Brunswick. So whatever their travel date was, whenever their onset of symptoms was, and the contact tracing that was done as a result of that, they were not in contact with anybody else. And so they were tested here in New Brunswick after they had symptoms develop, and they were isolated at their home.
Mr. Brown, do you have a follow-up today?
Yes, this one's for the Premier. Both you and Dr. Russell have talked in the last couple days about wanting to strengthen border controls in New Brunswick. But from the sounds of it, the current system is working. This last case was caught and was self-isolating at home and didn't come into contact with anybody. You mentioned that border controls came in into effect on March 25th, and we just had a very long period where we had no cases, community or travel related. So I guess what's the necessity to move to strengthen border controls, and what more could even be done at this point than we are already doing?
I think the situation is, it is encouraging when you hear how the system has worked and how people have responded and followed the rules of public health and isolated. That's very encouraging. And when we went through the snowbirds returning back from the south and we went through the Easter weekend and we saw, good results continue, that's all very encouraging. So now we're going into a new phase of opening up, more activities. As I mentioned, this week we will be doing that. And so we've gone through the phase one, and so we'll be moving into phase two. And the idea is that, okay, there's more activity going to now be happening in the province. We're also getting into construction season, and when we see projects that are being awarded for different companies throughout our province. So it is a balancing act between trying to bring our economy back, trying to let people open their businesses, trying to let businesses that are planning this period either to do major work or to have a requirement to rebuild their business or their industry and use potentially outside labor to do that. And how do we manage that? How do we monitor it? As we get into a vacation period, you get more people coming to the border for different reasons. So how do we just ensure that we have a process in place that allows us to get more freedom within our province and more capability of our businesses and to do what they do, to keep running and to expand or to grow or to maintain. And it's this balancing act we're going through. We'll be continually monitoring traffic, looking at the borders. We're saying, okay, what is the actual, we review the actual makeup of movement back and forth, what is absolutely essential, what is in the true sense of the word is economic development or economic essential needs for particular areas. So it changes with each phase.
Thank you, Premier. Thank you, Mr. Brown. Michel Corriveau, Radio-Canada.
Oui, bonjour. C'est une question pour le Premier ministre, M. Higgs. Alors, si je comprends bien, M. Higgs, vendredi, vous annoncerez la phase 2 de phase 2 d'ouverture. Donc, on parle bien d'ouverture de commerce, de garderie, de restaurants et tout ça là pour vendredi.
Well, I'm talking about that. We'll bring all of the details of that on in between this week. So it'll be either tomorrow or Friday, depending when we have the full package ready. And we're meeting again tonight. We met with Cabinet this morning. We're meeting with the COVID Cabinet Committee tonight to kind of finalize the documents. But you could look at what we put out 2-3 weeks ago, and you could say, okay, we had the 4 phases. We had a situation that basically, if we had certain conditions met, then that's where we would be. And so the conditions have been met. So I guess without disclosing any particular details and any particular items, from our original presentation, you could see what we're considering and contemplating as the next move of opening under phase 2.
Merci, M. le Premier ministre. Merci, M. Corriveau. As-tu un suivi cet après-midi?
Oui, toujours pour M. le Premier ministre, M. Higgs. Comme vous savez bien, M. Higgs, le Québec va ouvrir ses écoles bientôt et le gouvernement du Québec veut favoriser ce qu'ils appellent l'immunisation naturelle. Comme les relations avec le Québec sont assez proches, j'aimerais savoir, est-ce que vous trouvez inquiétante cette décision-là?
I think that might be a question for Dr. Russell.
Peux-tu répéter la question?
Au Québec, le Québec va ouvrir ses écoles, comme vous savez, et aussi le gouvernement parle depuis un certain temps déjà de favoriser l'immunisation naturelle. J'aimerais savoir, comme on est très près du Québec, est-ce que c'est inquiétant selon vous?
Si le gouvernement a parlé d'immunisation naturelle, ça, c'est pas quelque chose que j'étais au courant je me suis pas rendu compte de ça. L'immunité naturelle, ici au Nouveau-Brunswick, si ça arrive avec le nombre de cas qui sont récupérés, ou peut-être il y a des gens qui ont eu le COVID-19 mais n'étaient pas au courant, fur et à mesure on fait plus de recherches au niveau national, on saurait si on pourrait recevoir des tests de sérologues pour tester pour l'immunité dans les prochains mois. Mais à ce moment-ci, les mesures qu'on a en place pour la province du Nouveau-Brunswick, c'est pour la sécurité du Nouveau-Brunswick. Et fur et à mesure qu'on relâche les mesures, on va continuer à faire les choses qu'on a déjà mis en place au niveau de faire les tests, les dépistages, etc. Alors, sur le sujet d'immunité, c'est vraiment quelque chose qu'on pourrait faire des tests de sérologues peut-être dans les prochains mois en futur, mais c'est quelque chose qu'on discute avec il y a un task force au niveau fédéral pour faire des recherches sur ce sujet.
Merci, Dr. Russell. Merci, M. Corriveau. Laura Brown, CTV.
Hi, Premier. I'm wondering, there's been some concern from a construction site in Fredericton regarding workers that have come in from Quebec and that allegedly did not self-isolate for 14 days. Wondering if you can talk about that specific case, and if not, what are the rules for now that construction season, as you said, is ramping up? What are the rules for out-of-province workers?
Currently, the requirements would be that anybody coming from out of province needs to self-isolate for 14 days in order to resume activity, and all the while, respecting public health requirements once they do that. In this situation in Fredericton that you refer to, following the kind of the discovery, and I believe it was audited as well by our compliance officers, it was determined that, there were some concerns there about that they hadn't self-isolated as they should have. And that was reinforced, and the self-isolation was required, as well as the work habits around that site. So I believe that, to my knowledge, that situation has been addressed directly to ensure that they are following the rules.
Thank you, Premier. Ms. Brown, do you have a follow-up today?
Yes, and I hope that this is clear, but I'm wondering if it says progressively loosen under the yellow bar on the graphic that you guys provided weeks ago. And under that bar, that comes after potentially a month after April 24th. So the yellow section says gathering with physical distancing 50 or less. Do you foresee, because the next one is when a vaccination is found, do you foresee the next year or until a vaccination is found, that will be the limit of any kind of gathering of that amount, 50 or less, for at least a year?
So I guess I would comment that at this point, from the April 24th and looking at like we said, a 2 to 4 week period, and when we work, public health would advise us if there were some ability to move and open up into the next phase. So we're at that 2 week period as of Friday of this week. So there is a kind of a progressive change into the size of maybe groupings. Whether 50 would be the ultimate as you get to phase 3 or phase 4, depending on where we are in the province. Whether that'll be exactly related to whether we have a vaccine or not. I think that we're kind of, we're learning as we go in terms about the virus, and public health will be able to talk more about that as we learn more about the particular maybe attributes of the virus and the particular characteristics, and to make those decisions. But for now, what we bring forward this week is going to be based on moving into the next phase of what we had planned on back 2 weeks ago.
Thank you, Premier. Thank you, Ms. Brown. Andrew Waugh, Telegraph Journal.
Yeah, hi, Premier. Just wondering if you can give us an update on the federal top-up money for the nursing home workers. You talked a couple of weeks ago about how you absolutely were interested in that funding. Is there any new news on where that's at? Because I was talking to the nursing home workers and they're saying they don't have the money yet.
Well, that's true. They do not. However, We are working on that whole file. We've had meetings this week on that file with the intention that within, let's say, a week to 2 weeks on the outside, we would be able to bring forward a recommendation. So it's very much on the radar, as I said a few weeks ago. That would be the current update, that within 2 weeks on the outside, we would be coming forward with a recommendation.
Thank you, Premier. Mr. Waugh, do you have a follow-up?
Yeah, this one's Dr. Russell. So, Dr. Russell, I heard in the preamble you talking about how basically this case, this patient former patient that landed in Moncton, that information kind of never should have gotten out in the first place. Is that correct? And where did things break down, if that is correct?
So that's correct. There probably was a breakdown in the process. So I have several staff that are meeting with Public Health Agency of Canada as well as our partners in Alberta. So they're trying to decipher that right now. But again, I just wanted to reassure the public that the person who flew on that flight was not contagious at that time. So there is no risk.
Thank you, Doctor. Thank you, Mr. Waugh. Mathieu Roy-Como, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre Higgs. C'est au sujet de la frontière à Camonton dont on a déjà parlé entre Camonton et le Québec. Le village de Pointe-à-la-Croix s'est maintenant tourné vers ses avocats pour essayer d'éclaircir la situation sur le passage à Camonton parce qu'apparemment ce serait trop difficile là, de communiquer avec les autorités néo-brunswickoises sans passer par des avocats. Qu'est-ce que vous pouvez nous dire, Monsieur le Premier ministre, sur la situation à Camonton et sur les gens du Québec qui seraient censés pouvoir entrer au Nouveau-Brunswick pour acquérir des biens essentiels? Il me semble qu'il y a toujours des difficultés de ce côté-là.
Well, I guess firstly, it's disappointing to learn that the mayor's not able to communicate with anyone here in New Brunswick without having legal assistance. I think that we can certainly arrange for that, and he can certainly call through my office. I'm sure that Public Safety, the Deputy Minister, would take the call and review any of the concerns. So that we should be able to deal with that directly, one-on-one, not face-to-face necessarily, but one-on-one on a call. The other aspect of determining the essential services, nothing has changed on our requirements at the borders for several weeks now. And I've said here in these pressers before that I commend the diligence of our public safety officers and our compliance officers who are guarding our borders, so to speak, to ensure that while we can let people move in and out for essential services, we protect our borders. So maybe there's a disagreement on what an essential service is. And I know the longer this goes on, kind of the more maybe anxiety levels rise. And that's why we're starting to move and open up in different aspects of what we do internally. But right now, I've just encouraged the mayor to reach out, as I say, directly to my office or directly to the Minister of Public Safety and review the current guidelines and to determine what has changed within the community and their access for essential services.
Merci, Monsieur le Premier ministre. Monsieur Waugh, comment as-tu un suivi cet après-midi?
Oui, merci. Sur le même sujet, toujours pour M. Higgs, il est question présentement de réviser les contrôles aux frontières. Vous en avez parlé tout à l'heure. Camonton est censé avoir un statut spécial, justement parce que c'est un centre de service pour les gens du Québec. Prévoyez-vous resserrer les contrôles également à Camonton malgré son statut spécial, ou est-ce que vous pensez que c'est là pour rester le statut spécial du Québec à Camonton pour les achats essentiels?
I don't see at this point, from what I know, in terms of the Campbellton Act, it's required, like the proximity of access needed to support the community in Quebec. So I think that likely still exists, and so I don't see that changing. I guess as we have more information on, exactly who's crossing and why, it becomes just to ensure that under the original terms and conditions that we put in place are the activities, those of essential services. And we had identified that and that applied to people that were working, obviously, on one side of the border or the other on a regular basis, like working in a hospital in the area as such. It required going to the drugstore, and so areas that were required, I don't see that changing.
Thank you, Premier. Merci, M. Wacomo. Rose Saint-Pierre, Radio-Canada.
Oui, bonjour, M. Higgs. Ma question concerne la campagne marketing promouvoir jumelage emploi NB que vous envisagez de lancer, la campagne de 400 000 $. Ma question, est-ce que c'était une demande de l'industrie des pêches de lancer une campagne de publicité telle que celle-là là, pour jumeler des chômeurs avec les employeurs?
You know, the group that met basically to think about, okay, what could they do? Because this is a labor, what's it called officially, labor group that identifies workers with employers. In any event, I forget the precise name. But in that relationship, we were already embarking on that. We were working in terms of making that, looking at a campaign, but a very modest campaign, one on social media, one that, you know, involves stepping up for my New Brunswick. There was no contemplation of any kind in my office of a $400,000 campaign, none whatsoever.
Premier. Madame Saint-Pierre, as-tu un suivi cet après-midi?
Oui, toujours au sujet de cette campagne. Vous voulez combler 900 à 1200 postes. Avec le montant qui est accordé à la campagne publicitaire, ça revient à un investissement d'environ 400 $ par employé recruté. Pourquoi pas avoir mis cet argent-là dans l'augmentation des salaires plutôt que dans une campagne publicitaire?
Well, I think per my previous answer, there wasn't any $400,000 to begin with. So that's not a real expenditure, and I certainly didn't authorize it, nor would I. I know this group can operate independently, but I believe the money has to flow through public post-secondary education, training, and labor in order to be ratified. Now, I appreciate the committee works together, and I know that this group, I guess they're called the Labor Force Adjustment Committee, you know, are looking at how we fill those positions. They, I don't think, knew that we already had a campaign underway. As I said, a very modest social media campaign in order to make people aware. I actually think that through all the communications we've had to date, that most people in the province are very aware of the opportunities. They're aware of the employer situation. And I agree with your position that if I was going to spend money like that on a campaign, I would rather put it towards the worker to fill the job. And that's why I don't get involved with this program in a way that would allow us to change, I guess, marketing dollars for actually dollars that would be used in relation to the employee topping up the wages. That's where I'd put the money. This committee operates as an arm's length committee, so it's not one that I oversee, but we have a program lined up, very modest. You know, it could be somewhere in the less than $20,000 range. I'm not sure exact numbers, but it'll get out. We can do it through social media. We're just asking people to step up for New Brunswick. This is a situation that both the employees' opportunities and employers are helping to be in a different position so that we actually, at the end of the day, can say we're all doing our part. Because we can't lose sight of why we did this from the very beginning. We did this to continue the track record that we have against COVID-19. So let's not, I know it's disruptive. I know it's changing the way we've always done things. And you know, I have changed in this last 2-3 months, and things are very different than what I used to do. And in fact, this whole experience, and not only COVID, but this whole political experience is a very, very unique one in many ways. But let's think about why we're doing what we're doing, why we're focused on getting and ensuring that we can start up our province and not shut down again because we've had an epidemic that's got out of control. So let's not get caught up on the nuances. Let's just find a way to connect employers who want to help be part of our solution on the health situation, and employees who's saying, I can be part of this.
Thank you, Premier. Merci beaucoup, Madame Saint-Pierre. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. I know I've touched on this question before, Premier Higgs, but we are still hearing from a large number of property owners whose primary residence is Ontario specifically, but who spend 3 to 6 months of the year in New Brunswick and wish to return in the upcoming weeks. They notably play an important role in local economies, and they pay high second home property taxes as well. If they can provide proof of a quarantine plan that would allow them to self-isolate for 14 days and would also be willing to take a health test at entry and 14 days later, could their entry be decided on a case-by-case basis if precautions are followed?
So I guess this would be something I'll comment on. Dr. Russell may want to comment on as well. That's not part of our phase 2 at this point. But can it be going forward, given you know, what results we get over the coming weeks? It would obviously be something to be discussed. The same as we're looking at how do we get people back into back to work? How do we get projects back on the go? How do we get our economy restarted? I recognize this issue with other provinces. I recognize the value of having property owners here that are spending money in New Brunswick and enjoying what we enjoy every day here by living here. But at this point in time, it's too early to open the borders up, especially, you know, in a situation what we see with what they're currently dealing with in Ontario or Quebec. We have talked about relationships with PEI and obviously ultimately with Nova Scotia, but it has to be on a basis that it's kind of the risk is not going to be created in a way that we can't control, but it may be looking at other provinces and where they are at that point in time. And will there be new restrictions that we can put in place that will give us a higher degree of confidence? So I'm not ruling that out at all. I don't think Dr. Russell would as well, but it's not at this time until Public Health have reviewed the risk.
Thank you.
Well, I agree with the Premier at this point in time from a public health perspective. The border measures that we have in place are really around protecting New Brunswickers at this moment in time, because we do know that the risk of travel-related cases is there when we have provinces and jurisdictions around us that all have cases that are concerning.
Thank you, Premier. Thank you, Dr. Vicky Hogarth. Do you have a follow-up this afternoon?
I do, Bruce. It's just short. I guess I'm just curious if these people were to try to cross the border or come here by plane at this point in time, would they be turned away and turned back home?
Yes.
Thank you, Premier.
Thank you.
Thank you, Ms. Hogarth. Elizabeth Fraser, CBC.
Hi, Dr. Russell. Can you clarify where the WestJet traveler ended up? Are they back in Ontario now, or are they self-isolating in New Brunswick?
So for privacy reasons, I actually can't disclose that information because, again, the error in posting it in the first place was that the person had already finished their, they had already been cleared to fly in terms of having finished their self-isolation after their diagnosis. So at that point in time, there is no risk to the public, and therefore the information that is shared is always on a need-to-know basis in terms of protecting the public. So because that person has recovered, I don't have any authority to have information about their whereabouts today.
Thank you, Doctor. Ms. Fraser, do you have a follow-up today?
Yes, for Dr. Russell. This new case that has been found in the St. John area, did that person drive back or fly back to New Brunswick?
The details that I have on that case is that when they arrived in New Brunswick, whatever time frame that was, that they were self-isolating already, as everybody who comes into the province, regardless if it's air or by land border. They were doing their 14 days of self-isolation when they developed symptoms, and they had not been in contact with anybody else upon their arrival here in New Brunswick. And then once they developed symptoms, they called 811 and were tested very quickly. And so they are still continuing to self-isolate at home. So regardless of how you come across the border, you're supposed to self-isolate for 14 days. And so the information that I have on this this particular case is that when they arrived in the province, they self-isolated, and they are continuing to self-isolate.
Thank you, Ms. Fraser. Thank you, Doctor. Mark Rickard, Bugle Observer.
Yes, good afternoon. This question is for Premier. Mr. Premier, Prime Minister Trudeau announced an agricultural relief package, including $50 million nationally to purchase surplus food. In New Brunswick, the potato industry estimates that our surplus 2019 crop will be about $40 million. Will the province join the federal government in purchasing the surplus potatoes for this food relief program?
Well, we're currently looking at the federal program and what it will offer, as well as working with the local growers and producers in relation to the impact on the industry. So where we end up as a province in helping our growers and to surviving this, and obviously getting ready for the next planting season, is yet to be determined. But we are working through that to see what makes sense, what's possible. What's being done elsewhere, and how we can ensure that our farming industry continues and we can be ready for next year.
Thank you, Premier. Mr. Rickard, do you have a follow-up today?
Yes. A lot of these potatoes are not in refrigerated storage, so time may be of the essence. Is there a time frame when the farmers may be getting a word from the province?
Well, I know there's kind of, as I would understand it, there's kind of two time frames. One is certainly the planting season for this spring, so be ready for next year. And then once harvesting comes into play, then we'll be running out of storage because you've got to displace last year's crop, which should have been used up. So looking at other storage opportunities, I know that has been done in some other provinces. I think particularly PEI was involved in that process, although the volumes are much different. Is there an opportunity there? That's still being explored. And of course, the last resort would be to, we do not want to see the in this case, potatoes, we don't want to see them dumped. We don't want to see the food source lost. So we're working through those with the companies and then ultimately with the growers.
Thank you, Premier. Thank you, Mr. Rickard. Adam Harris, Telegraph Journal.
Thanks, Bruce. A question for the Premier. Premier, on the $400,000 recruitment program, government staff has said that the funding is provided by the Department of Post-Secondary Education, Training and Labor, but that the committee has the ability to select how they want the money spent. Just to clarify, is the government not providing the money, period? Or is there another dollar figure, or is there any dollar figure committed to the Labor Force Adjustment Committee?
Well, what I don't think the Labor Force Adjustment Committee knew, because they were acting kind of on their own, which I understand, is that we were already planning a social media campaign. We already had worked with, kind of to determine what that might look like, and on a program that was obviously much reduced in cost. I mean, we're talking something like, as I said, $20,000, maybe 25, 10, but we're not certainly in the range that was discussed here at all. And I don't think there was an understanding that we were actually doing that. We weren't just leaving this program unattached. We were going to stay very close to it, very focused on it. So I think that we have a program that is very reachable. I've announced the website here today. I've announced that we'll be giving more information going forward, how easy it is to tighten up, to connect employers with employees, and to allow that to happen in a very constructive way. So I'm confident we'll have something that works. Thank you.
Thank you, Premier. Mr. Harris, do you have a follow-up?
Yes, please, Bruce. To the Premier as well. Government staff confirmed that screening at airports began on April 25th. You said today that screening at the borders began on March 25th. I just wondered why the airport screening started later.
I don't know that I have any particular rationale for that, because we considered, airports are more federally operated than would be any sort of border, because there wasn't, there wouldn't be any border screening of any kind except for going between Maine and New Brunswick, and that was federally administered. So we would expect that could be something that would be federal in that regard, or at least that would have been my initial thought. But when we determined that actually people were coming and going domestically and weren't having any particular oversight, then we started moving in to say, okay, we need to start monitoring this. And, you know, we may learn some other things. As we monitor traffic around the border, we will look to, okay, how do we look further? If we think about the activity as the summer season rolls in, the activity on lakes and rivers and in open lands between, let's say, our borders, it becomes more and more of a challenge. So how do we measure that? How do we monitor that? It's going to be very critical how people actually help us to survey our systems and our borders to ensure that we can remain compliant.
Thank you, Premier. Thank you, Mr. Harris. Colin McPhail, CBC.
Hi there. My question's for Premier Higgs. The province's domestic violence shelters say they're in a serious financial crisis and have lost some employees who feel the health risk of working during the pandemic are too high for the wages they're being paid. They're asking the province to fully fund the shelters so they can increase wages, cover the cost of ensuring physical distancing, and the lost revenue of canceled fundraisers. What do you say to them?
I absolutely understand the situation that they have found themselves in this, very important service to our province. We can't lose sight of the need. We have many groups that have lost funding through what they would normally be able to ascertain from donations, and so we have to look across that spectrum and find how do we ensure that we're keeping the vulnerable members of society supported in a way that they're used to and in a way that's necessary. And so this group will certainly, the transition houses and shelters will be looked at in great detail to understand what can we do to ensure that they provide their service. And as we look at others, because we see it throughout our province, how their normal sources of funding have absolutely changed or dried up in many ways. And as we look as government, what we can do, it's about how do we spread, our dollars in a way that we can preserve what we must and ensure that we're meeting the needs that are most concerning.
Thank you, Premier. Mr. McPhail, do you have a follow-up this afternoon?
I do, thank you. This one's for Dr. Russell. Will the reopening of more businesses possibly announced this week trigger the ability to gather with 10 or fewer people now? And if or when we reach that point, what kinds of gatherings are acceptable if we're still limited to the two-household bubble?
So the whole concept behind the two-household bubble is about protecting people from having close contact with a large number of people. So when you're in contact with the members of the two-household bubble, we expect that, of course, you can hug and be within 6 feet of one another. Outside that household bubble, we expect everyone to maintain a distance of 2 meters or 6 feet at all times. So that is the advice moving forward, and that will continue to be the advice for public health moving forward. So with the exception of your two-household bubble, we expect you to physical distance yourself at all interactions with 6 feet or 2 meters.
Thank you. Thank you, Mr. McPhail. That concludes today's update. Thank you very much. Voilà la fin de notre mise à jour. Merci beaucoup.